Well, when it comes to this topic, one of the first things we have to realize is there's a lot of people that are doing VO2 max testing and RMR testing out there. And some of the population just understands the fact that what they're going to do is get, their resting metabolic rate, and therefore have an indication of how many calories they require in order to maintain or gain weight or lose weight. Or they'll get their VO2 max and they'll understand how they rate against others, their age and gender. But they believe that's the end of it. And for a lot of people that do the testing, it is the end. That's all they're interested in, is get people in, get them through, and even as we talked previously, get them a set of zones, even though it may not be the best way. So there's a ton of other information that is available within the metrics that are measured, especially with O2 and CO2 combinations, that you can use to be able to kind of differentiate between a cardiovascular limitation, a metabolic limitation, and a respiratory limitation. Even a neuromuscular limitation could be identified, or issues with efficiency. All of that stuff should be part of what we're doing with the data that we collect, because if the data is there, it's just going in and doing a deeper analysis. And if you do that, you get an idea of how each of their systems are responding, but more importantly, you get a very clear idea of what they should do to improve their health, their function, their longevity, their performance, whatever population it is. Really what you should be doing is testing in order to determine what the limitation is, and therefore what you're going to do about it.